We begin with a damning report card on Doug Ford's healthcare promises. Despite his government pledging billions to fix what has been described as a crisis in healthcare, Ontario's financial watchdog says it's still $21 billion short of what is actually needed. That put the Premier on the defensive today.
We're spending, folks, $75 billion. We've increased it by $14 billion. We're pouring money into the healthcare system.
But even with all that money and the promise of more hospital and long-term care beds, more nurses and home care, areas all buckling under immense strain, the Financial Accountability Office report finds it's going to fall short.
The overall spending plan is not enough to meet its commitments, let alone increases in demand from Ontario's growing and aging population.
Ford has long dismissed the financial watchdog's findings.
The government likes to talk about these reports as if it's some sort of snapshot.
And the Premier did just that.
The FAO, they only take a snapshot in time. They don't include the health transfers.
The opposition, though, claims Ford has been underspending on healthcare for years.
I think it was a devastating report and another example of how this government, despite making all these promises and releasing all these plans, isn't actually funding them properly and has created a crisis, the crisis that we're in right now.
The report finds there are approximately 250,000 people on surgery wait lists. 43% are waiting longer than the maximum clinical guidelines. The Premier used that today to justify his government's move to allow private clinics to do more surgeries like knee and hip replacements.
This is the reason we need to do things differently. This is the reason we got to get caught up on the backlog surgeries.
COVID exposed the strain on healthcare, but it's a problem that did not happen overnight. The interim Liberal leader acknowledged when his party was in power, not enough was done.
But here's the reality. We built or rebuilt 30,000 beds over 15 years. We need to do more.
It's not just more beds that are needed, it's the people to staff them. The report finds there will be a shortfall of 33,000 nurses and PSWs in the next 5 years.
We can't staff the beds we have now. That's the problem.
Ford was first elected in 2018 after making big healthcare promises.
To cut hospital wait times and put an end to hallway healthcare.
Today, 5 years later, he acknowledged he hasn't accomplished that. In fact, the problem is worse.
Good point. We went through, obviously, a worldwide crisis with a pandemic for well in excess of over 2 years. It really put pressure on the system. But we feel that we're moving in the right direction.
What now? Well, there is no quick fix. Watch for the budget, which comes out March 23rd. I was told today there would be more money in it for healthcare. The Premier also mentioned again today he will push for more money from the federal government. And I'll leave you with a sobering thought. The report warns if more isn't put into healthcare above what Ford so far has promised, we could have an even worse situation in our hospitals in 5 years.